What is reproductive psychiatry and why have most women never heard of it? You've noticed your mood falls apart at the same time every month. Maybe it's the 2 weeks before your period, the irritability, the anxiety, the sense that everything is too much. And then, pretty predictably, a day or two after your period starts, you feel like yourself again until next month. You've wondered if it's in your head. Sometimes maybe you've been told it's just PMS. It feels bigger than that. Or imagine you're pregnant or you have been pregnant and you're anxious, irritable, not sleeping. Maybe you were on a medication years ago that really helped you, but when you asked about starting it again, you were told it wasn't safe during pregnancy. So you white knuckled your way through month after month, assuming suffering was just part of the deal and the only option. Or maybe now you're in your 40s and something has shifted. You're waking up at 3 a.m. or you feel more sensitive or more reactive, can't think as clearly, and you just feel less like yourself. So you go to your doctor and your labs are normal and you're told it's just stress, or maybe it's just part of aging. That isn't the whole story, and you wonder, could my hormones have something to do with this? If any of those scenarios feel familiar, you are in the right place, and what ties all three of them together has a name. This is exactly where reproductive psychiatry comes in. So, what is reproductive psychiatry? Reproductive psychiatry is a subspecialty in psychiatry focused on mental health evaluation and treatment relating to the hormonal changes that occur across a woman's reproductive lifespan. For many women, mental health doesn't exist in a vacuum. It's inseparable from what's happening hormonally, and that means psychiatric care often needs to be tailored accordingly. This field specifically addresses the mental health needs that arise during times of hormonal transition, like the premenstrual phase, including premenstrual dysphoric disorder, preconception and fertility treatment, pregnancy, the postpartum period, and perimenopause and the menopause transition. In each of these stages, the clinical picture looks different. The risks, the treatment options, the medication considerations, all of them are a little bit different, but many women go years without ever seeing someone who has trained in this area. And here's something that surprises a lot of people. Reproductive hormones, estrogen and progesterone in particular, are not confined just to the reproductive system. They are active throughout the entire body and the brain. Estrogen supports the production and regulation of serotonin and dopamine, and these are the neurotransmitters that are most closely associated with mood, motivation, and emotional resilience. And when estrogen fluctuates and drops, so does that scaffolding that supports your emotional well-being. Progesterone acts on the same receptors in the brain that many anti-anxiety medications target. It is, in a very real sense, the body's natural calming hormone. When progesterone is low or fluctuating, that calming effect diminishes, anxiety goes up, and sleep becomes more difficult. So when hormones shift predictably across the menstrual cycle, dramatically after childbirth, and really unpredictably during the years of perimenopause, the result can be significant changes in your mood, anxiety, sleep, thinking, and your overall sense of self and well-being. And this sensitivity is real. It is biological. It's not something you simply have to endure either. Many women's brains are exquisitely sensitive to hormonal fluctuations, and it's not a flaw, it's just a biology. It's a feature of your neurobiology that deserves proper clinical attention. What does reproductive psychiatry actually address? First, let's talk about premenstrual dysphoric disorder, or PMDD. This is more than just bad PMS. It's a significant mood disorder tied to the luteal phase of the menstrual cycle, and it is treatable. I'll do a full episode on PMDD in week 8, so stay tuned for that. We also consider preconception planning. So if you're thinking about pregnancy and you're on psychiatric medications, or you've had a history of depression, anxiety, OCD, or ADHD, There is a lot of value in planning ahead, and it's also not a time to abruptly stop your medication. Reproductive psychiatry helps you make informed decisions, ideally before you're pregnant, and certainly if you are already pregnant. Anxiety and depression during pregnancy are very common and also widely underrecognized. The idea that pregnancy is a happy time sets women up to suffer in silence, and the medication question, what's actually safe versus what we fear is unsafe, is really nuanced and often misunderstood. And I'll do a deep dive into this more in week 10. Postpartum depression, anxiety, and OCD are also not character weaknesses or failures of motherhood. They are biological events in a period of massive hormonal upheaval. Postpartum is the biggest and fastest hormonal change that a woman can experience, all while trying to keep a tiny human alive on very little sleep. And there is help available. Week 7 and week 9 go deep on this. And then let's talk about perimenopause. The years before menopause can look like depression, anxiety, or just falling apart. And standard treatments often don't land the same way when hormones are the primary driver. This is one of the most underserved areas in all of women's mental health. I will talk a lot more about this in weeks 3 and 5. And then we also consider fertility treatments. The hormonal medications used in IVF and other fertility treatments can significantly affect mood. The emotional weight of fertility struggles is compounded when no one is watching out for your mental health in the process. Reproductive psychiatrists are prepared to help you through this. So why have most women never heard of this? Reproductive psychiatry is not widely taught in general psychiatry training. It sits at the intersection of two specialties, OBGYN and psychiatry, and historically it falls through the cracks of both. In general, research has not historically focused on women's mental health, so there are still a lot of research gaps, although thankfully more research has focused on women's health in more recent years. Most general psychiatrists receive little training on hormonal influences on mental health too, and most OBGYNs aren't deeply trained in psychiatric management. So the result is that women go back and forth between doctors, getting little pieces of the picture, but never really the whole thing. So that's exactly why this channel exists, and it's why the kind of care I provide at Elemental Integrative Psychiatry is built around the full picture. That's exactly what reproductive psychiatry addresses. At my practice, Elemental, we specialize in understanding how hormonal transitions affect the brain and mental health across the full reproductive lifespan. A thorough evaluation looks not just at your symptoms, but at when they occur, how they're affecting your daily functioning, and what else might be contributing, including hormonal changes, sleep, nutrition, stress, and your support systems. We always collaborate closely with your OBGYN, therapist, primary care doctor, or any other members of your care team or support system to make sure that nothing falls through the cracks. Your treatment plan may include psychiatric medication, hormone-informed approaches, evidence-based therapy, supplements, sleep support, nutrition guidance, and stress management. And it's all tailored to your values, your lifestyle, and your goals. You don't have to keep white-knuckling your way through something that has a name and a treatment. Relief is possible, and you really deserve to feel like yourself again. If this resonated with you, please subscribe, because every week we go deeper into one of these topics. Next week, I'm covering 5 signs that your mood issues might be hormonal. That one tends to surprise people, so stay tuned. I'll see you there.